Good morning, all. Today my class of presentation is myasthenia gravis. What do you mean by myasthenia gravis? I'll tell you. Myasthenia gravis, in other words, we are saying that myasthenia gravis it is an autoimmune disorder affecting the myoneural junction, and it is characterized by varying degree of weakness of voluntary muscle. Means when there will be a myasthenia gravis attack, so there will be a weakness in our muscles, in the voluntary muscles like face or in our hands or in our fingers. So it's basically a very common disease in India as well. And in other words, we say that MI. This one is MI. My asthenia and gravis. My means muscle, asthenia means weakness, and gravis means the grave. So, what should be the causes of myasthenia gravis? In myasthenia gravis, the receptors at muscle surface are destroyed, alright, or it is deformed by antibodies that prevent a normal muscular reaction from occurring. Means in myasthenia gravis, what will happen? The receptor sites, it means the signals we receive, the receptor sites muscle surface are destroyed due to the antibody reaction, or due to the, because this is an autoimmune disease, so our immunity, our antibodies only attack on our this one, the receptor, due to which there will be an muscular reaction from there will be a destruction of all the muscle surfaces, or it is deformed by antibodies that prevent a normal muscular reaction. All right, so muscle reaction, what kind of muscle reaction we are getting if our this receptor sites are blocked? The there will be weakness in the muscles or in the motor complexes. The causative factors in as unknown. Actually, we don't know the causative factor because it is idiopathic, and the disorder maybe have the genetic link. Means previously their father or mother or the grandmother and grandfather should have might be having this kind of disease. That's why it is transferred through genetically. So before the patient comes to you, you should ask the brief description of the history, that what kind of is there any kind of surgical history, past medical history, or is there any kind of myasthenia gravis patient, if his or her father is suffering from myasthenia gravis, or is it like the are they under the treatment of myasthenia gravis? All right. Next, some of the main causes or the risk factors. The risk factors include the female gender, like female gender and under the 40 years of age, male gender and age is above 60 years, and third one is it is an autoimmune disorder. Factors that can worsen the gravis, because originally it occurs in those patients who are above 60 or above 50. All right, so these patients are more effective because they will get easily fatigued, and they'll have illness, stress, extreme heat, and some medications such as beta blockers or calcium channel blockers or quinine and some antibiotics, due to which it can worsen the myasthenia gravis. Means the patient is suffering from these so many of conditions, or if he is taking some medication like beta blockers, or as I told you, the CCB, like calcium channel blocker, or some antibiotics, that will worse the condition of the myasthenia gravis. So we have to take care of when we are prescribing or we are giving the medication to a patient. Now, what is the root? How actually myasthenia gravis occurs, and what will be the root cause analysis? I told you that the exactly cause that why our immune system is attacking our own body, due to which the myasthenia gravis occurs, it is idiopathic actually. And but still we have to show it. So due to etiological factor, as I told you, the lymphocytes, which lymphocyte actually produce the acetylcholine receptor antibodies, which attack the postsynaptic muscle membrane. You know that if you remember your anatomy and physiology in the first year, so there will be a synaptic muscle membrane, due to which these are the receptor sites from where they receive the signal. So if they will destroy these antibodies, attacks on the post-sympathetic muscle membrane, due to which there will be a depletion of acetylcholine receptor or the muscular junction, and due to which there will be a defect in the transmission of impulse from nerve to the muscle cells. Mean if a nerve is sending any kind of signal, to the muscle cell and the muscle receptor site is broken or it is destructed by the antibodies, then definitely it will lead to any kind of weakness, any kind of muscle drooping, or facial expression might be changed. It will actually change and it will lead to the myasthenia gravis. All right, so next one is the sign and symptoms. What will be the sign and symptoms? You have seen this face, like his one eye is closed, here his both eyes are closed. So this is diplopia and ptosis. You know, in diplopia, we are having two eyes mold, and in this one, ptosis, we have one eye mold one. So these are the sign and symptoms. By seeing the facial expression of the patient, you will be able to see whether it is a symptom of MG, like myasthenia gravis or not. All right. And some of other symptoms are like there will be, if you will see the face of a person, that should not be a cheery one. Means if we are laughing, so if a normal person laughs, so what will happen? His cheeks should be flexed, or they should be, there should be possessiveness in this facial expression. All right. If, like for example, if I'll ask you to smile, you will stretch your cheeks and you will smile. But if you'll ask the patient of myasthenia gravis to smile, so he'll have a blunt facial expression because the muscles or the receptor sites are not having that signal, not receiving the signal, due to which his facial expression is true. So there will be a weakness of muscle of the face and throat, and generalized weakness of the facial muscle result in the bland or blunt facial expression. If you have seen the patient in the metro hospital as well, like in the myasthenia gravis, if you are seeing a patient, the expression will be blunt. Laryngeal irritation will cause the voice impairment, obviously, because these are all the muscle. When we are stretching, tongue is also a muscle. If we are not involving it or the receptor sites are damaged, we are not able to pronounce, appropriate words as well. This will cause the laryngeal irritation or dysphonia, and there will be an increased risk of choking, because when we eat something, we use our muscles, we use the signals to swallow anything, and the patient with the myasthenia gravis are having more danger of choking. If he is eating anything, so might be there will be a danger of choking. Generalized weakness of all extremities and intercostal muscles, resulting in decreased respiratory capacity. As I told you, like the muscles, the thoracic cavity, it is, the intercostal phase are muscles only in between the rib. So if there is a myasthenia gravis patient and the sympathetic and the receptor sites are damaged, what will happen? Definitely the extremities or the intercostal muscles result in decreased respiratory capacity or its vital capacity. The patient won't be able to breathe in severe cases. So what will be the management for this if the respiratory capacity is compromised? What we are going to do? Will we provide oxygen, or we should have to put the patient on ventilator? Obviously, we have to put the patient on the ventilator, because if we are administering oxygen, the patient won't be able to breathe because his muscles are relaxed. He is not able to breathe. So we have to, by forcefully, we have to insert the breathing inside, so that oxygen should go inside the brain and the muscle should not be damaged. Myasthenia gravis is purely a motor disorder with no effect on the sensation and the coordination. All right, means if we'll ask the patient to, it's a purely motor disorder. Why it is a motor disorder? Because if you'll pinpoint your finger on his feet, he'll able to recognize it. If you are, asking the patient to move forward, definitely the patient will move forward. There will be no signs of negative coordination. All right, there will be proper coordination for the patient with myasthenia gravis. What test should we have to should be done to check the patient? If the patient is having myasthenia gravis or not? So this is the enterophonium test. Actually, what we are going to do, the injection, this tensilon injection, may result in all the temporary movement. Mean if the patient is having a blunt expression, what we are going to, because in Parkinson's as well, the patient is having the blunt expression or the small footsteps the patient is having in Parkinson's. So if we want to check, we have to do the endophonium test. Due to which we have to give an tensilon injection, and it gives actually a muscle strength to a patient. And by doing this endophonium test, we are able to diagnose the patient is in myasthenia gravis or not. Next one is blood analysis. We have to go for the ABG. All right, that what kind of how much oxygen is present in the blood. All right, and how much is the pH of the blood, because the patient may have the respiratory compromise, and a blood test may reveal the presence of abnormality in antibodies, that what kind of antibodies are present inside the blood, or which disrupt the receptor sites and where the nerve impulses signal muscles to move. All right, IcePack is have you seen for example, like if the patient is having tosses, or the patient we have to give place the ice over the eyelid, so that it will provide the cooling to the lid, which improve actually the tosses. And what do you mean by tosses is actually drooping of the eyelids. As I given you the picture of tosses or the patient in the previous slide. Now, repetitive nerve stimulation. We have to repeatedly, the physiotherapist or the doctors or the nurses have to give the repetitive nerve stimulation, due to which the nerve should be stimulated and the function starts to improve. And PFT we have to do, the pulmonary function test we have to do. And next one is medical management. In medical management, the cholinesterase inhibitors we have to, because as I told you, these our the myoneural junction, or this one, the receptor sites are destroyed by the conditions, and corticosteroids we have to give, and immunosuppressants we have to give. Like in COVID patients, we are using the plasmapheresis as well, so that the antibodies or the new blood will start fight with the virus. So same as in myasthenia gravis, we are giving this one, plasmapheresis too. You know about plasmapheresis or not? All right. So next one is surgical management. In surgical management, what we are going to do, we are going to do the thymectomy, so that the thymus gland is removed. Like this one is a video thyroscope, in which we visualize through the video, and then we have to open, and then we have to remove this thymus gland. And for that, we have to make an incision to the transcervical thymectomy incision. It is upper the sternum, and then we have to make the incision. Afterwards, we have to do the thymectomy. Next is dietary management. In dietary management, we are going to do, we have to reduce the protein intake to 10% of the total calories, replace animal proteins such as possible with the plant protein. We have to eliminate the milk products, because it is source of calcium as well. Eat more and more fruits or vegetables, and sure that they'll originally grown, means it should not be purchased from the food shops or something. If it is original, then it will affect good. Now, eliminate the unsaturated vegetable oil, margarine, this one. Then we have to use extra virgin olive oil, as your main fat, because the main fat is also, if it is there, then it will also cause a damage to your body. And then next comes the ginger. We have to take ginger, and because these are all are polysaturated, vegetables. Then what should be the nursing management or the nursing diagnosis? Ineffective breathing pattern related to intercostal muscle weakness, impaired verbal communication related to weakness of larynx, lips, mouth, and pharynx and jaw, impaired physical mobility related to voluntary muscle weakness, risk for aspiration related to weakness of the valvular muscles, disrupted sensory perception related to tosses and decreased eye movement. I am giving you the assignment. write down the nursing care plan for the patient with the myasthenia gravis. Alright. For any queries, kindly contact me.